Hi, I'm Dr. Bhargav Rao from PathoFast Lab in Pune, where we perform a lot of blood tests for patients who have PCOS or PCOD, which is a condition in which women have irregular cycles, acne, hair on their face, together with infertility. Patients are often asking us what kind of test results they are going to see if they have PCOS. So normally for PCOS, we do a series of blood tests to diagnose it. Amongst these tests are commonly the testosterone test, the total testosterone test, which is a measure of how much male hormones or androgens are present in a woman's blood. Together with this, we also do two tests called the LH and the FSH test, which are basically measures of fertility hormones. Should be a certain proportion of these hormones for a woman to have normal fertility, and in PCOS we find that this proportion is totally opposite. Together with this, we also do tests like HbA1c, which tells us whether the woman is diabetic or she's on the way to becoming diabetic, because in women with PCOS they tend to have a higher than normal blood sugar level, and there are also several other tests that are done. So on this page I've included the values of these hormones as measured in women who have PCOS versus what is actually normal. So if you take a look, for example, the total testosterone level is in women, it's normally somewhere between 50 to 70. But in women with PCOS, we find that this lower level it's usually more than 30 or 40 and can go much higher. That's one thing. The second one is the LH to FSH ratio. Now this is basically the, if we measure the value of the LH in the woman's blood, and then we measure the value of the FSH hormone, and then we divide the LH by the FSH, we get something called the LH to FSH ratio. Now this should never be more than 2:1. Right, so the amount of LH should not be more than twice the amount of FSH in the blood. But in PCOS, we find that this actually goes much higher. You get maybe 3 or more than 2 times the LH as compared to the FSH. The third thing is a hormone called the DHEAS. It's a pretty long name. It's basically the hormone that is created before testosterone is made. So it's the precursor to testosterone. It's from the DHEAS that we later get the testosterone. So we also find that in women with PCOS, the DHEAS level is also much higher compared to normal patients. I've written the level there. And the last one is the HbA1c, which is basically an average of your sugar over the last 3 months. Now, if you're normal, this should be less than 5.6%. But in women with PCOS, we usually find this value to be much higher than that, maybe 6, 6.3 or even higher. So these are the values of the hormones that we find in women with PCOS versus those who don't have it.